to the Continental Hospitals Private Limited over here for this health seminar conducted by HATA. Before I begin, I introduce myself. That is, my name is Mr. Pawan. On behalf of Chairman, and I thank him for giving me this opportunity. I welcome the dignitaries onto the stage. The guest of honor, Ambassador from New Delhi, Mr. Chintapalli Rajshekhar, IFS Garu, onto the stage, please. So please come onto the dais. I welcome ATA President, Mrs. Madhu Bomineni, onto the stage, ma'am. I welcome the ATA President-elect, Mr. Jayant Challa, onto the stage, sir. I welcome the co-chair for the event, Mr. Venu Sankineni, onto the stage, please. I welcome the chair, USA Health Seminar, Dr. Srini Gangasani, onto the stage. And I welcome our chairman and chair for India Health Seminar, Dr. Guru and Reddy sir, onto the stage. I request my colleagues to present bouquets to the dignitaries onto the stage. Arogyam Dhanasampada Shatrubuddhi Vinashaya Deepam Jyoti Namostute. The power of lamp is to give knowledge and to eradicate whatever are the inner enemies of ours. So I request all the dignitaries to start the proceedings by lighting the lamp.
Ladies and gentlemen, and distinguished guests, Honorable Ambassador, and our esteemed healthcare experts here, Dr. Nori Dattatreya Garu, Dr. Guru Reddy Garu, Dr. Suresh Garu, Dr. Anand, and Doctors Anand, Sunita, and Dr. Gaddi Kuppala, Dr. Ipuri, and then our own Dr. Srini Gangasani Garu. A warm welcome to all of you on this Christmas Day health seminar at the Continental Hospitals. Thanks to the chairman of Continental Hospitals, Dr. Guru Reddy. Thank you for having us here. Thank you. Our focus today revolves around crucial aspects of our well-being, which is so important. And there are so many with specialists in heart health, cancer, oncology, and digestive health today are prepared to share the insights tailored to our needs, especially our Indian community. On this holiday, your presence, on this Christmas Day, your presence here is a proof to the immediate recognition of the importance of our health. So let us all start the journey, not on the January 1st, not tomorrow, but today, for our well-being. Thank you. Your commitment, you being here, your commitment here is genuinely appreciated, and it's greatly needed for all of us. A special acknowledgements to our health seminar team, Dr. Guru Reddy Garu and Dr. Srini Gangasani Garu. Thank you for organizing this remarkable event. And then congratulations to our Vedikalu chair and then co-chair Venu Sankineni garu and Jayan Challa garu. Thank you. Before we get into the seminar, I just want to say a few things about ATA. So let me introduce you to the American Telugu Association, those who are new to it. It is established 33 years ago to serve as a bridge to our children, grown or brought up, born and brought up in India, in the United States, as a cultural bridge to our children, and also to serve our community, the Telugu community in the United States. Over the years since it started to now, the needs, the number of Telugu people in the United States has grown tremendously, and also our needs also have grown. Before, we used to meet for the cultural aspect of it with our families, and then help in the community. But now the needs have grown. Like, so even the ATA services have also grown to accommodate those. So we have so many emergency services to accommodate the visiting parents that are fall ill, or so many accidents that do happen that you hear, to educational, business, and to the children's Bhagavad Gita lessons, or we name it. There's so many literary, cultural programs that we conduct over, throughout the year. Whatever it is, ATA is dedicated to serve our community. So we also host a biannual convention, and these Vedical events are prelude to that convention. So this time, the 18th ATA convention and youth conference is happening in Atlanta, Georgia next year, June 7th to 9th. It'll be held at the World Congress Center in Atlanta. So it is a mega event expected to draw about 15,000 Telugu people under one roof to experience. These are today it's a seminar that we have so many people here. So multiple sessions in various sectors of different people interests to accommodate the interests of these 15,000 people, cultural, musical, not only those, but business, women's forum, for youth forums, medical, CME, so many that will be conducted over the 2 days of the event. So it's happening on June 7th to 9th in Atlanta, Georgia. So I invite all of you to attend, and our eminent panel of speakers here to participate in ATA convention, in the CME and the health breakout sessions. Thank you. And I invite all of you, each and every one of you, to attend and actively participate in this convention. Once again, thank you, and I extend my heartfelt wishes for the Christmas and also a safe New Year. Thank you very much.
Welcome address and brief introduction about ATA to all of us who are present over here. Now I request a message from the ATA President-elect, Mr. Jayan Chala, to come on.
Hello, good afternoon. You have a mic or this is the best one? Good afternoon, everyone. Andarki, Merry Christmas and greetings to you all on this joyous day of Christmas. So, and all the honorable guests and distinguished personalities here, from ambassadors to doctors and all the people who came here to listen to the message of the healthcare. Thank you for coming here on Christmas holiday and to participate in this health seminar. Like Madhugaru said, ATA is American Telugu Association is a 31-year-old organization serving the communities in the US and in India. So one of the things that we do is Vedukalu, we call it. Every other year we come to India to do Vedukalu activities, to interact with the Telugu community here and perform various activities. So they include literary, cultural, health, business, and charitable activities. So for this year, we are doing these charitable activities from December 10th through December 30th for 21 days. Quite a few activities we're doing. And as part of this, we're doing two main health programs. One of it is the health seminar here, and the second one is the mega health camp in Kajwel in a couple of days. So when became responsible for this healthcare for Vedukalu activities, became president-elect and planning for the Vedukalu activities, I wanted to do something at Continental Hospital. Dr. Guru Reddy is also my first cousin. He's a legend in all our family. If we don't do well, my parents always used to say, listen to, see how Guru Anna is doing. Why don't you guys come anywhere somewhat closer to how he is performing? So, he was always a tall figure in our family to live up to. So, I wanted to do some activities at the Continental Hospital. Then Dr. Gangasani Srini, I know him for 25 years, and I talked to him, see how we can combine all of our friendship and relationships and do something good for the community, good for ATA. So that's how this business seminar has come in. So it's a great, collaboration between ATA and API, which is an association of Indian physicians in the US, and Indian doctors and Indian hospitals here. So this partnership, through this health seminar, we want to serve the communities both here and the US. And also I want to acknowledge, outside of these two major health seminars and camps, when we visit schools and colleges, we are taking help from doctors, local doctors here, to go and talk to them about mental health awareness. That's becoming a huge issue in both here and in the US. So when we went to Basara Triple IT, where there have been multiple cases of mental health awareness, we asked Dr. Guru Reddy to see, can we get a senior doctor from here to come and address students? So he was gracious enough. So we had a senior doctor come in and talk to students about mental health issues, which was a huge success. So when we went to Sri Venkatara University, we took help from the local hospital, local doctors to go and talk to them. So all of those things are going well. And I just want to mention about Telugu diaspora in the US, right? The Telugu diaspora is the fastest growing diaspora. It's probably more than 1 million Telugus now live in the US. With the increasing population of the Telugu community, the challenges are also are there. The mental health, the physical health, and when students come here, every year we have 30 to 40,000 students come to the US from India, and they don't have sometimes insurance, and they run into medical health issues. So I would like to take this partnership between ATA, API, and doctors here to address that issue and probably serve the community better in the US. Educate them before they come to the US, and if they have any issues, partner with these like-minded organizations and express and provide support to them. So with that, I just want to again thank you, Dr. Guru Reddy and the Continental Hospital team. Thank you, Dr. Srini Gangasani and the RP team for organizing this and making this happen. Thank you.
For enlightening us with what ATA is extending towards the Telugu people who are especially the students who are coming to the US. Now, I would like to invite the man with the bow, Dr. Srini Gangasani, to give his message.
Warmest wishes for all of you on this holiday season coming on a Christmas day. May these holidays bring you joy, peace, and health to all of you. I want to just say a few words about Indian physicians in United States. Every sixth patient in United States is being treated by an Indian doctor. That just gives us I think it's so much more appreciation. So please give a big round of applause to all the doctors. I think it's because of our education, what we got here is what. So if you take, like I think Jayan said, we have a lot of leaders, lot of great personalities, the CEOs from Indian community as well as the Telugu community. If you take from Silicon Valley on the west to Wall Street on the east of United States, we have multiple eminent personalities, including our own Nori Dattatreyu Garu, Padma Shri Nori Dattatreyu Garu, famous radiation oncologist, who is also with us. All this success to Indian physicians, Indian people is not just because of the talent, hard work by these physicians, but the great environment provided by India for us when we were growing up. I think it's a great thing that India did for us. I think these are the kind of things we can do to give it back to the community. I think that's what I think. I appreciate ATA doing all these activities to give back to the community. Thank you, Madhu Garu, thank you, Jayan Garu, giving me this opportunity. I'd also like to thank, I think, Dr. Gurnath Reddy Garu and Continental Hospital for doing a wonderful job, especially Srikanth. I think his team, I think Anupama Garu, were very prompt in getting all the information to put together this seminar by eminent physicians from all over the world, some from United States, some from here. Big round of applause to Continental Hospitals and their team. Finally, I would like to thank the speakers who took their time off on this holiday season to come here to educate and enlighten us regarding the different topics which would be definitely helpful both for doctors as well as non-doctors. So have a great holiday season and a happy, prosperous, more importantly, healthy New Year 2024. Thank you.
Without much delay, I would like to request our chairman, sir, to come and welcome and introduce our guest of honor for today, Mr. Chintapalli Rajshekhar.
Hi, good afternoon. It's a great honor to be here, and particularly on a day of Christmas. I was just wondering, what will Santa bring to me this year? Now, Santa certainly has blessed me bringing ATA, as my gift, I guess, to Continental Hospitals for this educational event. Everything takes time, everything takes a lot of planning and coordination, particularly when you're doing, transatlantic between two different continents. I remember, in between my travels and early mornings and time differences, when Srini was communicating, Jayant was communicating, when this should be organized, who are the speakers and all of those things, and finally we are here. So without much ado, let me introduce the guest of honor, and after his address, we'll proceed with the scientific program. So, this was kind of very incidental or coincidental that one of our friends have suggested, hey, have you met Ambassador Rajshekhar? I said, no. I think Ambassador Rajshekhar is touted to be something next. I don't want to disclose anything here and be out of turn at the end of the day. So he happened to accept this invitation on behalf of ATA, and then I immediately informed the ATA leadership, this is okay, and they agreed. So Ambassador Rajshekhar is a senior diplomat in the Ministry of External Affairs. He is a member of the Indian Foreign Service since 1990, and having cleared the UPSC exam in the first attempt. He is son of the soil. He is a Telugu person who initially went to school at the Nagarjuna Residential College and subsequently did his law with a gold medal from the Usmania University. Ambassador Rajshekhar later on went to the Bennett University to obtain a PhD degree. So I should, sir, call you doctor. So we are honored to be amongst the doctors here. Ambassador Dr. Rajshekhar, that's so unique and wonderful. So he is a PhD holder as Indian Foreign Service. He was also the first South Asian, I understand, who received the international fellowship to the Japan Foreign Affairs Ministry, where he had his stint and worked very closely with our current Foreign Minister of India. So Ambassador Rajshekhar thereafter has specialized, subsequent to that, he specialized in the Orient by serving in Korea, Mongolia, Japan, Director of East Asia at the headquarters. He has also served as our man in Havana, Minister in London, and Director General of ICCR's Indian Council of Cultural Relations. His current mandate is to facilitate greater engagement of various states and union territories of India with the world. He is the OSD to all the states of India uh, in the Ministry of Foreign Affairs at this point in time. And more interestingly, a great tidbit of his biography, Ambassador Rajshekhar speaks 10 languages. He speaks English, Hindi, Telugu, Urdu, Marathi, and 5 foreign languages. With that includes Japanese, Korean, French, and Spanish. It's remarkable linguistic talent, and such talent from India, we know where this country's destination would be. Sir, we hope and we desire, as the first Telugu person, that someday that you'll be the foreign secretary of this country and lead our nation, and that's not too far away. With no further ado, I welcome Ambassador Rajshekhar to give his address. Thanks.
Thank you very much for that very kind introduction. I don't know how that crept in. I didn't give it myself. It was rather embarrassing, that you, especially before such eminent luminaries, that I have the distinct honor and pleasure to be with you this afternoon, this wonderful, joyous Christmas day. First of all, I must tell how proud we're all about the accomplishments of the American Telugu Association members and other members of the diaspora who have been to the US and over the years have, through the hard work, through your connect with the country and also patriotic contributions, that you have generated such goodwill that the view of the US has come to alter over the years. I happen to be the regional passport officer here 30 years ago of the undivided state. At that time, there used to be, I think about the time that ATA was founded, there used to be a view whether we shall give passport and allow these accomplished people to leave the country, which is considered a brain drain, so to say. You're all familiar with that thing. In Telugu, educated at Mother India's expense, but kicking on her chest and leaving the country. That was one minority view, but fortunate that we didn't fall for it. And thanks to the large numbers that had gone and also the great work that you have done and your connect through various initiatives, this ATA, Vedukalu, and numerous ways that you are contributing, Nandi, and adopting your villages and organizing health camps, and even this kind of sharing the best global latest practices. This also is a great, as the chairman has said, great gift, because what we study in the university academics textbooks, that's only one part. Interacting with such luminaries that you develop such insights, that also is a great gift, although it may not be exactly visible as any physical material gift. So we're very proud of ATA. We wish you very successful deliberations in Atlanta, Georgia. There is a little scope for confusion here. If you simply say Georgia, that people may, these days Indians are traveling abroad in large numbers, and one of the recent discoveries is Georgia in the former Soviet Republic. So better we say that Atlanta city. That hope that you'll have very productive deliberations there. And I would like to heartily congratulate the organizers for putting together and taking a look at the program, that you have covered the entire lifestyle problems that we are increasingly coming across, from the diabetes to heart diseases to mental health. Completely covered the spectrum. Wish you productive deliberation to you. Uh, Thanks to the good work and the goodwill that you generated, now US and India have become global strategic partners. Also, because of the geopolitical emerging trends, that our partnership and collaboration are going to increase. So our collaboration is not only going to be confined to we serving in US or US doing in India, also in third countries and also all over the world, collaborative projects. We are, because now is also becoming almost earlier times, presidential visit of US used to be once in a couple of decades, whereas now very shortly we may come into a period that we will have almost annual summits, or at least alternate years. So we're always scrambling, exploring, trying to find newer areas, sectors to collaborate. This being such a distinguished cerebral group, I leave the thought of invitation that your valuable suggestions and ideas are always welcome as to how India and United States can collaborate to add value bilaterally, regionally, and also in third countries. Then, as you get into your technical subjects, before that, let me share my little thought that there are numerous opportunities emerging because of the increasing longevity. Life expectancy is increasing. That somebody was very complimentary, said that I am looking quite young, but by Government of India's age prescription, next year I'll be superannuity, so to say, retire. But by now we have learned to preserve ourselves, that one may expect the next 25, 30 years, not for me personally, but generally people are going to live longer. So that's going to create an entire set of issues, and geriatry as a growing medical subject. About 2 3 decades ago, we have come up with this information technology adding value services, globally. Similarly, this could be a big subject of pension homes and old age homes post retirement. You have seen that happening, that from more expensive places people are shifting to the more affordable Caribbean and all from US. And similarly, trends are beginning to form in India also, because now gone are the joint families that we live together after retirement, the children we look after, and also the real estate costs are increasing. So here is a new emerging opportunity of medical, social, and enterprising, because also some of you are very successful entrepreneurs. I leave this thought that we could develop these along spectrum of costs, 1 star, 2 star to 5 star homes. So in this, I'm sure the governments will be very happy to facilitate and support. Then United States has numerous accomplishments in the field of medical science also, and Hyderabad can emerge as a major global hub with all your contributions. Uh, and during COVID, we have also proved that we can scale up rapidly in providing products, pharmaceutical, vaccine, and the services also. As we do this, the thing is, United States, for all its great positives, also is a high cost, high outcomes health systems. We need to develop how we customize that to Indian context, because we cannot afford to leave out millions of people. So we need to see how we can ever keep bring lowering the costs of healthcare, even as we improve the quality. This is something that I would leave this thought for your deliberations during the rest of the day. I would like to most sincerely thank you for giving me this great honor of meeting you. I got to interact with such luminaries who are missionaries committed to eradicate lifestyle problems, cancer and other these ailments. That I wish you all very best, and once again, Merry Christmas and a Happy New Year. Thank you.
Yes, I request Jay and Chela sir to acknowledge the ambassador.
I just want to acknowledge a few folks from MATA who have traveled all the way from the US to be part of this Vedukalu, and here from the left, Satish Reddy, who is ATA treasurer, is from Dallas, Texas. Yeah. And Parmesh Bhim Reddy is from Delaware. He is past president of American Telugu Association. And Kiran Pasham is from Atlanta. He is the conference convener for the one that's happening in June 7th, 8th, 9th. And if any other ATA team members are here, just to stand up. But thank you for coming here and being part of the Vedukalu.
Now I request our chairman to present the memento to our guest of honor. Yes, I request ATA President Mrs. Madhu Bomineni and ATA President-elect Mr. Jayant Challa to come.
I think with this, we are ending the inaugural session. We're going to get started with the scientific program. I once again thank the ambassador for so kindly to be present here on a holiday and giving his valuable message. And the session, as we all know, the agenda has been circulated. If not, they can send the copies around. So each speaker is going to have about 25 minutes. And at the end of the session, we will open the forum for questions.
నమస్కారం అండి, నా పేరు మధు బొమ్మినేని. ఆటా తరపున మా కార్యవర్గం బృందం అందరి తరపున మీ అందరికీ మెరీ క్రిస్మస్ అండ్ ఎ వెరీ హ్యాపీ అండ్ హెల్తీ సేఫ్ న్యూ ఇయర్. ఈరోజు కాంటినెంటల్ హాస్పిటల్స్లో ఆటా వేడుకల పరంగా హెల్త్ సెమినార్ జరుగుతుంది. చాలా మంచి రెస్పాన్స్ ఉంది. దాని గురించి మన ప్రెసిడెంట్ ఎలక్ట్ జయంత్ చల్లా గారు తర్వాత చెప్తారు. ఐ ఆల్సో వాంట్ టు సే, ఆటా ఎన్నో కార్యక్రమాలు ఇక్కడ లాస్ట్ 2 weeks నుండి జరుగుతుంది. దీని తర్వాత మనకి నెక్స్ట్ జూన్ 7th నుండి 9th వరకు 18వ ఆటా మహాసభలు జరగబోతున్నాయి. అట్లాంటా, జార్జియా, యునైటెడ్ స్టేట్స్లో ఈ కార్యక్రమం జరుగుతుంది. పెద్ద ఎత్తున జరపడానికి మనం అంతా తయారవుతున్నాము. ఇక్కడ నుండి అందరినీ కూడా ఇన్వైట్ చేస్తున్నాము. సో దీనికి మీరు అందరూ వచ్చి ఈ మహాసభలను విజయవంతం చేయాలని అందరినీ కోరుతున్నాను. థ్యాంక్ యూ అగైన్ అండ్ మెరీ క్రిస్మస్.
అందరికీ నమస్కారాలు. నేను జయంత్ చల్లా, ఆటా ప్రెసిడెంట్ ఎలెక్ట్, ఈ వేడుకల చేరు. సో ఈరోజు ఇక్కడ కాంటినెంటల్ హాస్పిటల్లో ఆటా హెల్త్ సెమినార్ జరుపుకుంటున్నాము. ఈ ఆటా హెల్త్ సెమినార్ తోటి ఏంటంటే మనకు ఆటాకు హెల్త్ పైన, మెంటల్ హెల్త్, ఫిజికల్ హెల్త్ పైన ఇంపార్టెన్స్ గురించి దీనిలో చాలా సబ్జెక్ట్స్, ఆన్కాలజీ, కార్డియాలజీ, సైకాలజీ, ఇటువంటి చాలా సబ్జెక్ట్స్ పైన ఈరోజు ఎక్స్పర్ట్స్ వచ్చి ఇక్కడ డాక్టర్స్కు, నాన్ డాక్టర్స్కు చెప్తున్నారు. ఆట ఇది ఒక ఆట వేడుకలు జరుపుకుంటున్నాము ఇక్కడ ఈ మన తెలుగు రాష్ట్రాలలో.
కాంటినెంటల్ హాస్పిటల్స్కి ఈరోజు ఇంత ముఖ్యమైన అంతర్జాతీయ మెడికల్ కాన్ఫరెన్స్ నిర్వహించుతున్నందుకు ముఖ్యంగా శుభాభినందనలు. చాలా ప్రముఖులైన అంతర్జాతీయ స్థాయిలో ఖ్యాతి పొందిన వైద్య నిపుణులను పిలిచి ముఖ్యమైన వ్యాధులు, క్యాన్సర్, డయాబెటీస్ లాంటి లైఫ్ స్టైల్ ప్రాబ్లమ్స్, ఇంతకుముందు మనకి ఇన్ఫెక్షస్ డిసీజెస్తో బాధపడేవాళ్ళం, కలరా కానీ లేకపోతే అటువంటివి. ఇప్పుడు అక్కడి నుంచి లైఫ్ స్టైల్ ప్రాబ్లమ్స్ అనేవి వస్తున్నాయి చాలా ఎక్కువగా. సో వీటిని ఎట్లా ప్రపంచ స్థాయిలో బెస్ట్ ప్రాక్టీసెస్ ఎట్లా చేస్తున్నారనే విషయంలో ప్రముఖులు వాళ్ళ పరిజ్ఞానాన్ని పంచుకునేందుకు మీ క్రిస్మస్ శుభ దినం రోజు ఇట్లా చేయటం అనేది కాంటినెంటల్ హాస్పిటల్ ముఖ్యంగా అభినందించవలసిన విషయం. ఈ దీంతో అమెరికన్ తెలుగు అసోసియేషన్ వారు కూడా కలిసి వాళ్ళ వేడుకల్లో ఇది ఒక భాగంగా, తర్వాత ఇంకా కూడా వాళ్ళు హెల్త్ క్యాంప్ ఇట్లాంటి మంచి పనులు ప్రజలకి ఉపయోగకరమైన సేవాభావంతో చేస్తున్నారు. వాళ్ళకి మరొకసారి నేను హార్దికంగా ధన్యవాదాలు తెలియజేస్తున్నాను. ఇట్లానే మన హైదరాబాదు, మన భాగ్యనగరం, మన తెలంగాణ రాష్ట్రం, తెలుగు రాష్ట్రాలు ఇంకా అభివృద్ధి చెందాలని ప్రపంచ స్థాయిలో మనం వైద్య సేవల విషయంలో కానీ, మన కోవిడ్ వచ్చినప్పుడు మన వ్యాక్సిన్ ఇక్కడ తయారు చేయటం, అత్యంత స్వల్పకాలంలో చాలా ఎక్కువ స్థాయిలో ప్రపంచానికంతా వ్యాక్సిన్ మైత్రి ద్వారా మనం వ్యాక్సిన్ పంపగలిగేంత స్థాయిలో మనం వ్యాక్సిన్ని ప్రొడ్యూస్ చేయగలిగాము. అట్లానే హైదరాబాద్, తెలంగాణ, మన తెలుగు రాష్ట్రాలు ఇంకా అభివృద్ధి చెందాలని, రాగల నూతన సంవత్సరం 2024 మీకు అందరికీ శుభం కలిగించాలని కూడా నేను ఆశిస్తూ